Do you check your blood pressure at home and trust the numbers you see on the screen? What if I told you that a simple mistake you make every day could make your blood pressure appear much higher or much lower than it really is? I'm Dr. Aliza Wright, and after more than 2 decades caring for older adults with heart and circulation problems, I can tell you this with complete honesty. Most people are not misled by broken monitors. They are misled by small habits that seem harmless. A chair that feels comfortable, a sleeve rolled just a little too tightly, a rushed reading before breakfast, a measurement taken after walking in from the mailbox. These do not feel like major mistakes, but blood pressure is not a forgiving measurement. It changes with position, muscle tension, stress, breathing, bladder fullness, conversation, timing, clothing, and technique. When even one of those goes wrong, the number can shift dramatically. In today's video, we'll reveal the most common blood pressure measuring mistakes seniors make at home and show you exactly how to avoid them. If you or a loved one takes blood pressure medication or is concerned about heart health, this information could help you get more accurate readings and better protect your health. Make sure you stay until the end, because one of the most common mistakes is something most people do every single day without realizing it. Before we begin, please subscribe to this channel, turn on notifications, and join our community for life-saving senior health guidance. Let me start with Elaine, because her story honestly stays with me. Elaine was 72, sharp, organized, and the kind of person who followed instructions carefully. She bought a home monitor because her doctor wanted better tracking between visits. For the first week, her numbers seemed terrible. One morning, she was 168/94. The next, 161/91. Then, 171/96. She became terrified that something catastrophic was building inside her body. She stopped sleeping well. She checked her pressure more often. Every high number made her more afraid, and every bit of fear pushed the next number even higher. By the time I saw her, she was convinced she was one bad reading away from a stroke. But when I asked Elaine to show me exactly how she measured, the truth appeared almost instantly. She believed she was taking a morning resting reading. She was not. She was taking a reading from a body that had already started its day, already responded to movement, caffeine anticipation, mental stimulation, and low-level stress. Her blood pressure was not being measured in a baseline state. It was being measured in a stirred-up state. That difference changed everything. So let's begin with mistake number 10, because it creates trouble before the cuff even inflates. Mistake number 10, measuring too soon after activity. One of the most common home errors is taking blood pressure too soon after physical activity. And I do not mean just exercise in the usual sense. Seniors here avoid exercise before a reading and think of treadmills, bicycles, or long walks. But the body does not see effort the way the mind sees effort. Climbing stairs, carrying laundry, bending to feed the cat, walking to the porch for a package, hurrying because the phone rang. All of that can activate the cardiovascular system enough to distort a reading. Your heart rate changes. Your blood vessels respond, your nervous system shifts, and now the monitor is not measuring your resting blood pressure, it is measuring your recovery from activity. I had a patient named Leonard, age 76, who took his blood pressure every afternoon after getting the mail, because that was the most convenient time. His numbers were always higher at home than in the clinic, and no one could figure out why. Then we realized his mailbox was at the end of a long sloped driveway. He would walk down, pick up several envelopes and sometimes a package, come back uphill, sit immediately, and hit start. That tiny routine was enough to push his systolic pressure up by 20 points. Not because he was getting sicker, because he was measuring during a moment of physical strain and cardiovascular rebound. The correction is simple, but it has to be strict, not casual. You need at least 5 quiet minutes before measuring, and those minutes need to be truly quiet. No walking, no chores, no lifting, no pacing, no rushing to just do it quickly. Sit down, let your body settle, let your breathing slow, let your heart stop responding to movement. If you want a number your doctor can actually use, you cannot measure a moving body and call it resting blood pressure. Those are two different things, and seniors who confuse them often end up frightened by numbers that were never their true baseline in the first place. Mistake number 9, taking a reading with a full bladder. Now here is one that surprises almost everyone, and yet it changes readings far more than people realize. A full bladder can elevate blood pressure enough to turn a normal reading into a concerning one. Seniors often measure first thing in the morning because it seems logical. But first thing in the morning is also exactly when many people are most likely to be holding urine. That matters. The body responds to bladder fullness through nerve pathways that increase sympathetic activity, and that can push the blood pressure upward. So if you measure before using the bathroom, you may be documenting a physiological stress response instead of your real resting pressure. I remember Walter, 79, a retired accountant who loved routine. Every morning, same chair, same lamp, same notebook, same monitor. He was proud of his consistency, but his morning readings began creeping upward without any obvious reason. Diet unchanged, medication unchanged, weight stable. Then I asked him a question nobody had asked before. Do you go to the bathroom before you check? He looked at me and said, "No, doctor, I do it right after, because I don't want to forget the reading." That one detail was enough to explain weeks of alarming numbers. When Walter started emptying his bladder first, his pressure dropped back into the range we expected. Nothing magical had happened. No new treatment had saved him. He had simply stopped measuring a body under internal pressure. That is why I tell seniors this rule in very plain language. If you feel even a little urge to urinate, go first. Do not tell yourself it's minor. Do not assume it won't matter. Blood pressure is sensitive to things that seem small. And in home monitoring, small things become big errors because there is no nurse standing nearby correcting them. Mistake number 8, talking, watching, or interacting during the measurement. This next mistake is one people know in theory, but they underestimate in practice. They know they probably shouldn't talk, yet they still answer a question from a spouse, comment on the weather, glance at the television, scroll through a phone notification, or speak to the monitor itself like it's a stubborn appliance. The problem is not just the sound of your voice. The problem is what talking and engagement do inside the body. Speech changes breathing. Thinking changes nervous system activity. Emotional content changes vascular tone. The measurement becomes contaminated by your own interaction with the moment. Gloria, age 70, used to take her blood pressure every evening while FaceTiming her granddaughter because it fit into their routine. Her numbers were always unpredictable. Some evenings, she was fine. Some evenings, she looked hypertensive. What changed? Sometimes the conversation was calm. Sometimes it was funny and animated. Sometimes she was emotionally touched. Sometimes she was telling stories and laughing hard. The cuff did not know the difference between happy talking and stress talking. It only knew that the body was active, the breathing pattern had shifted, the muscles of the chest and throat were engaged, and the arteries were no longer being measured in stillness. If you want an accurate home reading, the measuring moment has to be silent and boring. No television, no phone, no conversation, no reacting to the previous number, no saying, "That can't be right," no reading headlines, no multitasking. Sit still, say nothing, and let the machine do its work. Seniors often think this sounds overly strict, but blood pressure measurement is one of those areas where strict is what creates truth. A relaxed, silent body gives clean information. A socially engaged body gives noise. And when noise becomes data, bad decisions follow. Mistake number 7, sitting the wrong way. This is where many home readings begin to drift without people realizing why. Because posture feels trivial until you understand what it does to circulation. If your feet are dangling, if your legs are crossed, if your back is unsupported, if you are perched on the edge of a bed, or if you are half twisted on a couch cushion, your body is working harder than you think. Muscle tension changes, venous return changes, vascular resistance changes. Blood pressure does not live in isolation from body position. It responds to it immediately. I had a patient named Marjorie, 74, who measured in what she called her favorite cozy spot. It was the corner of a soft recliner. The trouble was her knees were slightly elevated, her feet rarely sat flat, and she often leaned sideways toward a little end table while the cuff inflated. She believed comfort meant accuracy. It did not. When we changed nothing except where and how she sat, her numbers dropped significantly. She had not been misdiagnosed by a machine, she had been misled by furniture. That sounds almost ridiculous until you see how often it happens. The correct sitting position is more formal than people expect, and that formality exists for a reason. Sit in a chair with your back supported. Put both feet flat on the floor. Do not cross your legs. Do not tuck one foot under the other. Do not sit on a high exam table-like surface with your feet hanging. Do not lean forward. Do not hold yourself up without back support. Let the chair carry your spine so your muscles are not quietly working in the background. Seniors who fix posture often discover that their mysterious blood pressure problem was at least partly a chair problem all along. Mistake number 6. Letting the arm hang or holding it incorrectly. Now we come to one of the biggest technical errors, and it has everything to do with gravity. Your cuffed arm must be supported at heart level, not close to heart level, not somewhere in the neighborhood, at heart level. If your arm hangs low at your side, the reading can come out falsely high. If your arm is lifted too high, it can come out falsely low. Why? Because blood pressure in the artery is influenced by the vertical relationship between the cuff and the heart. Gravity changes the pressure the cuff is sensing. Raymond, 78, took his pressure on the couch with the cuff on his left arm and the remote in his right hand, and while his left elbow floated unsupported beside him. He thought he was being still, but his arm was hanging below heart level the entire time. His readings looked terrible. When we had him repeat the measurement with his arm resting on pillows so the middle of the cuff sat level with the center of his chest, his systolic number fell by nearly 20 points. The device had not lied. It had reported exactly what it sensed in a badly positioned arm. So here is the standard I want burned into your mind, because this one changes lives. Rest your arm on a table, desk, or firm support. Use a pillow or folded towel if you need height. The arm should be relaxed. palm up or comfortably open, not tensed, not reaching, not suspended in the air. The middle of the cuff should line up with heart level. If you are guessing, you are probably off. Seniors need to stop treating arm position as an optional detail. It is not a detail. It is part of the measurement itself. Mistake number 5, using the wrong cuff size or the wrong kind of monitor. If you remember nothing else from this video besides the final mistake, please remember this one too. The cuff has to fit. A cuff that is too small or too large can distort the result enough to cause real medical harm. Yet many seniors buy whatever monitor is on sale, use the cuff that came in the box, and never once check whether it matches their upper arm size. Others use wrist devices because they seem easier. Easier is not always better. When possible, a validated upper arm monitor is preferred because it tends to be more reliable for home use. Nora was 69, petite, slender, and tired all the time. But her home monitor kept showing high readings. Over months, more medication was added.